The first cranial nerve that we're going to test is the olfactory nerve, which is cranial nerve 1. We're going to test this by having the patient smell coffee through each nostril. So we'll have them smell with one. Can you smell the coffee? Mm-hmm. And we'll have them smell with the other. Can you smell with the coffee? Mm-hmm. All right, so that presents as a normal test because they can smell the coffee, but if they couldn't, then it would be abnormal. The second nerve that we're going to test is cranial nerve 2, which is the optic nerve. We're going to do this by taking visual acuities and conformation visual fields. So first we'll start by having them read a distant target. So if you cover up one eye and read that line of letters.
TZVECL.
Good. And then cover up your other eye and then read that line of letters.
TZVECL.
Good. And then we'll test their peripheral vision by doing their visual field. So I'll have you cover up that eye and I want you to look at my open eye here and tell me how many fingers I'm holding up, but keep looking here.
2.
Good. 5. Good.
1.
Good. 2. Good. And then cover up the other eye and then look at my open eye here. We're going to do the same thing.
1.
Good.
5.
Good.
1.
Good. 2. Good. So this patient had a normal response because she was able to see my fingers and then she was also able to read the distance target. But if she could not, then that would be an abnormal response for cranial nerve 2. The next cranial nerve that we're going to test is cranial nerve 3, which is the ocular motor nerve. We're going to first test the pupils. So I'll just have you look out there at that distant target. So we have direct constriction and consensual constriction in that eye, and then we'll test the other eye, and we have direct constriction and consensual constriction in that eye. And the last part of the pupil exam is to do the swinging flashlight test to check for APD. And there is no APD present. The next part of this cranial nerve testing is to check that the eyelids are symmetrical, and they look grossly symmetrical. And then the last part of this cranial nerve exam is to check the extraocular eye muscles. So I'll just have you look at my light here and just follow my light with your eyes and keep your head as still as you can. And let me know if you feel any pain or if you ever see two of my lights. So the normal response for this is that the pupils constricted with light, there was no APD, the eyelids look symmetrically normal, and the extraocular eye muscles were able to move in a normal response with my light. So if it was abnormal, pupils wouldn't constrict, you would see asymmetrical eyelid position, or you would see a constriction in the movement of the eye muscles. The next cranial nerve that we're going to test is cranial nerve 4, which is the trochlear nerve. We're able to test this nerve by looking at the extraocular eye muscles in the exam that we did previously. Her eye muscles were normal, so this cranial nerve is normal. If it was abnormal, the patient would not be able to look down and in. The next cranial nerve we're going to test is cranial nerve 5, which is trigeminal. We're going to start by checking to check the sensation of the patient's corneal response. So we'll take this cotton swab and tap the patient's cornea. And so since she blinked, she was able to feel it. And then we're going to test different areas of the face to test sensation of different divisions of the trigeminal nerve. So we're going to test division 1 by rubbing the forehead. Can you feel that?
Yep.
Good. And then we're going to rub the cheeks. Yep. Can you feel that? For the second division. And then the third division, we're going to rub the chin. Can you feel that? Yep. Good. And then the other part of this test is we're going to have the patient copy jaw movements. So I'll have her bring her jaw out, in, and side to side. She'll just copy my movements. Good. So since the patient was able to make all the movements and she could feel all the sensations, that's her cranial nerve 5 is normal, but an abnormal response would be she wouldn't be able to sense some of the areas, or she wouldn't be able to make the jaw movements. The next cranial nerve that we're going to test is cranial nerve 6, which is the abducens nerve. We already tested this nerve with the extraocular eye muscle movement test that we did previously, and since the patient was able to move their both eyes laterally, that was a normal response. If it was abnormal, they would not be able to move one or both of the eyes laterally. The next cranial nerve that we're going to test is cranial nerve 7, which is the facial cranial nerve. We'll start by asking the patient if they've had any changes in taste recently.
No.
Since she's had no changes in taste, then that's a normal response, and obviously if she did have changes in taste, then that would be an abnormal response. The second part of this test is to check facial muscles. So we'll have the patient act different actions that we tell them to do. So we'll have the patient smile, have the patient frown, have the patient show their teeth, have the patient puff out their cheeks, and have the patient clench their eyes shut. All right, and so since the patient was able to make all of these movements correctly, that's a normal response, and if they weren't able to do these movements, it would be abnormal. The next cranial nerve that we're going to test is cranial nerve 8, which is the vestibular. We're going to start by asking the patient if she's noticed any changes in hearing or balance.
Nope.
So that's a normal response. Obviously, if it was abnormal, she would have noticed changes. And then we'll also ask if she can hear sounds in both ears. Can you hear that?
Yes.
Can you hear that? And then obviously if the patient couldn't hear one of those sounds in one of the ears, then that would be abnormal, but she had a normal response. The next cranial nerve that we're going to test is cranial nerve 9, which is the glossopharyngeal. We're going to start by asking the patient if they've had any changes in taste recently. As before, and she states no, so that's a normal response. Obviously abnormal would be if she said yes. And then the second part of this exam is to test the gag reflex. So I'll have the patient stick out their tongue. And she has a normal gag reflex. Abnormal would be if she didn't have the reflex. The next cranial nerve that we're going to test is cranial nerve 10, which is the vagus nerve. We're going to check for hoarseness, and we're going to check the uvula to make sure that it's not deviating to one side or the other, but that it's right in the middle. So we'll have the patient say ah. Ah. Yep, and there's no deviation. It's right in the middle. So that's a normal response. As I said, an abnormal would be if it was deviating to one side or the other, or the patient noticed or the doctor noticed hoarseness. The next cranial nerve that we're going to test is cranial nerve 11, which is the accessory nerve. We're going to start by having the patient shrug her shoulders, and I'm going to lightly push down on them, and there is equal resistance between the two shoulders, so both cranial nerves are working equally. Then we're going to have the patient look to one side, and I'm going to push against her, and there's resistance on that side, and then the other way, and have the patient push against, and there's equal resistance on both sides. So that's a normal response. An abnormal response if the resistance is asymmetric on the shoulders or on the cheek. The last cranial nerve that we're going to test is cranial nerve 12, which is the hypoglossal. We're going to look at the tongue for furring, atrophy, or any deviation, and we're also going to have the patient do some tongue movements. So I'll have her stick out her tongue, and it looks normal, and then I'll have you move your tongue in between both your cheeks. And she has normal movements, so that's a normal response. Abnormal response would be if she couldn't make the movements or if we saw the furrowing, atrophy, or deviation.